arriving at the scene. As a first aider will be the primary contact with an injured employee, this holds some important responsibilities. Things to bear in mind when first arriving on the scene of the incident are: make the area safe and clear away any unnecessary personnel. Get as much information about the incident as possible in order to assess the right treatment. Collect as much information about the patient as possible. This will include any known medical conditions or allergies that may impact the treatment. Try to remain as calm and confident as possible. Panic is contagious. Don't be afraid to ask for assistance if you need any before emergency services arrive. Always be honest about your training and skills. Never attempt any treatment that you aren't familiar with. The need for recording incidents and actions. When a first aider attends the scene of an accident, one of the first considerations should be to record all relevant details on the incident, as well as any actions that you undertake. Not only will this aid medical professionals a great deal when they arrive, but it will allow an accurate timeline of events for any other relevant purpose. The clarity and information recorded here could be an invaluable asset when emergency services arrive and assess the situation and the condition of casualties. However, you must also note that much of this personal information should be confidential. First aid equipment. Every first aider should have immediate access to essential first aid equipment as part of their role requirements. This may differ depending on the size and role of the premises and their personal assessment. Therefore, a personalized first aid box or kit should always be carried or available to every first aider. With a bare minimum of content, you should include the following essential pieces of equipment: plasters of assorted sizes, sterilized iPads, some wound dressings of assorted or adaptable sizes, disposable non-latex gloves, bandaging, safety pins, appropriate health and safety documentation. Always ensure that expiry dates are checked and equipment replaced as necessary. Prioritizing the treatment of casualties. After initially assessing a situation and ensuring that emergency services are in transit, a first aider will need to prioritize the treatment that injured employees and/or casualties receive. This will determine how quickly patients are treated and the immediacy or seriousness of the situation. When determining the priority, the following conditions need to be taken into consideration, and in this specific order: breathing, any difficulties doing so, and so on; bleeding, the amount, ability to stop it, and so on; bones or burns, the severity of breaks, amount of burnt skin, and so on; other conditions. These can obviously be changed or adapted as necessary or when circumstances change. Contacting the emergency services. Depending on the circumstances, a first aider will either contact the emergency services themselves or instruct a deputy or another employee to do so. It is obviously important that this is done as soon as possible. In the UK, the number for emergency services is 999. The number 112 can also be used in every EU country as a viable alternative. As a rule of thumb, when contacting the services, the acronym LINE, line is sometimes used when advising the order of information to be given. L means location, address. I means incident, the details of. N means number of casualties. E means the extent and seriousness of the injuries. Incident reporting and recording. We have already covered why incident reporting and recording is important in a medical situation. However, it is also important that the right kind of information is documented. This must include the patient's details, name, address, and so on, vital signs of the patient, patient's history, full details of the incident, including exact timings, injury observations and treatment details, any other information you see fit as crucial to the incident, your own contact details for future reference. Dealing with a casualty, building trust. During any kind of accident or medical emergency, emotions and anxiety levels will no doubt be high. The best way in which a first aider can help those injured is to remain calm, take charge of the situation, and be confident. To prevent any injured person from becoming agitated and possibly making their injuries worse, trust should be established with the patient and a comforting tone should be maintained. This can be achieved in a number of ways. Always explain your actions and treatment before doing anything. Introduce yourself and ask their name. Crouch or kneel to be at the same height as the patient. Speak in a confident, reassuring manner. Treat the patient with respect and dignity. Ask their consent before tending to their wounds. Give them a choice of actions wherever possible to help them maintain a level of control in the situation. Dealing with a casualty, diversity, and communication. Another thing to take into consideration when dealing with injured employees is the ability to communicate clearly. The appearance and age of the patient may be a mitigating factor in their treatment, especially when dealing with children or the elderly. Other things to assess are: do they speak the same language as you? If not, is there anyone in the locality who can translate? Always respect the patient's wishes and beliefs and accommodate their beliefs as much as possible. Be aware of any disability that may affect treatment or communication. Simple sign language or hand motions may suffice for short-term communication. Dealing with a casualty when a casualty resists help. The mental state of a casualty can easily be affected by their injuries. This may lead them to become agitated or even resist the beneficial treatment that a first aider may be trying to apply. In a worst-case scenario, they may become violent and adversarial and continually refuse your assistance. If this happens, you should stay in the vicinity but keep your distance. Patients have an inherent right to refuse help, but you should tell emergency services that this has happened and communicate any appropriate concerns. Otherwise, you should employ the following tactics to calm the situation. Assure the patient that they are doing nothing wrong and their actions are understandable. Don't crowd or force your treatment onto an employee without their consent. Don't enter into an argument or conflict with the casualty for any reason. Be open and honest about the risk and their injuries. Explain the reason for any actions you take. Dealing with a casualty. Care of personal belongings. One thing that can be easily overlooked during an emergency is personal security and usefulness of a casualty's belongings. At all times, the patient's personal belongings should be kept alongside the patient. Not only will it ultimately reassure the employee, but it provides a way to get further identification and information about a person's history, health status, and next of kin. This can be vital if they become confused or lose consciousness. In all cases, get the patient's consent or that of a guardian before searching or taking any belongings. Also, ensure that these are passed on to emergency services when they arrive and transported along with the patient. Cleaning up after an incident. It is the responsibility of a first aider to ensure that all waste is safely disposed of following an incident. This will ensure that any possible infection from the incident cannot be passed on to yourself or any other employees and/or bystanders. Dealing with waste. Following the treatment and transportation of the patient, all remaining waste must be dealt with in the following manner. Any soiled clothing, dressings, gloves, and materials must be collected together for immediate disposal. This waste should be packaged and disposed of in clearly marked orange or yellow plastic bags. Sharp objects, hypodermic needles, and so on should be carefully transferred to a purpose-made receptacle, usually known as a sharps bin. If there are any doubts on how to dispose of any of the waste, they should be taken to the nearest hospital for secure disposal. Summary. In this module, we have learned that first aid treatment can have life-changing consequences. A first aider needs to assess a situation quickly and efficiently. A first aider has important actions to perform as soon as they arrive at the scene of an incident. Incident details must be recorded accurately and methodically. It is very important to take care of medical waste to prevent any infection.